Hi, it's Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma, April 4th, 2020, COVID update. Hope everyone had a good Friday night, a good Friday, and a good Saturday. It's a little cold here in Oklahoma City. It's warming up finally a little bit. Um, but it was kind of a cold day or two, and with the humidity, it got a little cutting this morning. Anyway, latest things with COVID statistics. We're about 1.2 million, and I think about just shy of 70,000 deaths. Oklahoma City, United States, were about 310 or 15,000 people, 8,300 deaths. So that both those numbers are skyrocketing. That we're in the acceleration phase. And keep in mind that's just mostly due to the East Coast and Louisiana and more. If you're looking at those maps that I've posted previously in the last few days, to the East Coast more than even the central U.S. And then Oklahoma, we're 1,100 with 42 deaths. So it's going up everywhere. I do want to comment on the Oklahoma data first. There was something that came out, which I also posted, that showed the testing rate per 100 or per 1,000 people. The average is somewhere around 3 to 4 in the country per 1,000 citizens per state. Oklahoma is in first place in terms of being the lowest testing state. We're at 0.5. Most states, I think when I looked through, there was only one state that was under 1 per 1,000, and that was California. And in their defense, they have 44 million people, I think, somewhere in that range. There's one person who reads these who will, I'm sure, check my statistics and let me know if I'm off. Please do. But so even though they're under 1, they are definitely testing a lot of people because they're the most populous state. So it's a little interesting though when you look at Oklahoma statistics, when there's a lot of people here who don't think there's that much coronavirus and we don't have to worry that much. And I still have people saying we're not New York, just like some of our leadership in the government said, we're not any of these big cities. Well, the big cities have done testing, and so of course we're not any of those people, because if we don't test, we don't know, and if we don't know, we can't plan, and more importantly, we can't account for what's going on. There's been a lot of suspected COVID deaths in the last few weeks. The nursing home in Norman that has had 2 deaths had 6 or 7 pneumonia deaths in the 2 weeks immediately before their first COVID case, but none of those people were tested for COVID, and I don't know if it even entered the mind of the people involved, but there was no testing for them, so who knows what happened, and that's going on throughout the state on a consistent basis. So that's the only kind of bad news I have, is that we've led from the bottom. But other than that, Oklahoma's doing great. I had a wonderful conference call with Kirsty Winfrey, Carl Roskowski, Cameron Mantor, Jeff Cruzan, Tommy Abraham this morning. They were all the head kind of hospital leadership teams, not on a CEO level, but on a chief medical officer leadership type level at Saints, OU, and Integris, and they really brainstormed about what each institution is doing with their surge planning, and also we're beginning the process of organizing what to do for surge planning in the community if we go over our hospital's ability to manage patients at the hospital. All of the people in the group were very clear that the CEOs of all the different main hospital systems in the state of Oklahoma, have been discussing plans with the governor's office and to an extent the state health department now for several weeks. But what we're doing is going to be transitioning to more granular things, to have the actual programming in place if we have to make some adjustments. But I want to definitely give credit to the governor's office for frequent, almost daily communication with Tim Pearson from Integris, Chuck Spicer, everyone who is a hospital CEO. And all these CEOs and leadership people are just bending over backwards for the community. And there's way more of them than I even know their names. So just know that they're helping and doing everything they can. Monday, the governor's going to do a proclamation or get a proclamation certified about emergency powers. We certainly are all hoping that means he's going to help the healthcare systems lead the charge versus trying to direct the healthcare systems on how to lead the charge, because since the health authority and the governor's office are not experts in actually administrating healthcare, we're hoping they're going to facilitate these really smart people I'm assisting do their jobs even more effectively. But I'm very, very positive about where we are. If you could listen to these conversations, you would be so impressed with the physicians, the administrators, their thought processes for not just members of our community, our children, our parents, ourselves, but also for their staffs. I mean, one of the central things they're talking about is, I mean, how do we help these nurses? How do we help these respiratory therapists? All these people within the hospital who are putting themselves at risk. How do we help the physicians on the front line? How do we get, I mean, they're very focused on the entire package. I also want to give a lot of credit to, again, News Channel 4, News Channel 9, and then News Channel 5. I talked to Brent Hensley today, who's their director, and I'm blanking on his exact title. He and I have been friends for a while, and Channel 5 is going to start participating with our group and getting information out there. I mean, it's amazing in Oklahoma, you can make a phone call and people just step right up, and I'm so appreciative. So hopefully you'll be seeing a lot more educational things on the news this coming week or two, not by me. I'm going to be using these gentlemen to be the extenders and communicate, because you need to hear it from a lot of different people with different credentials and different voices repetitively in the public space to actually change behaviors, which is what we're doing. On the front of therapy, there's some exciting news. I think a lot of people are pretty nervous right now, and I want people to understand that, yes, this is a nervous time. But again, if you're not in Oklahoma, there's still great health care. So that for those of you who don't live in Oklahoma, it's hard for you to imagine how good our health care is, but it really is fairly fantastic. And number two, there's these really brilliant scientists. And so one of the things I've been reading about is antibody treatment strategies. So if you look at hepatitis A, rabies, Ebola, if you get the infection or at the first sign of the infection or you get exposed, they're going to give you an antibody injection. And those antibodies are what, I'm just going to take half my viral particle here today, and you see the little spikes. We'll just say any viral particle we're talking to has these today. An antibody, when you get an injection of it, or if you've made one to it, it binds to this part right here, the little pokey part, and it renders it inactive. And so when we get a cold or a flu normally, we make antibodies, and then we get immunity from that strain or a variety of different versions subsequently. When you get a vaccine, you're giving proteins from the surface of the viral particle or the bacteria. So you make antibodies, so the second that virus or bacteria enters your body, your antibodies inactivate it before you can do that. So one of the older ways of treating things, but we still do it all the time now, is just to figure out and synthesize an antibody to inactivate a virus. And that's different than giving a vaccine, so your body does it for you. It's pre-made and ready to go instantaneously. So there's been some massive progress on antibody development against COVID. And in some preliminary data that's just out now, there has been a very effective antibody shot developed, and they've given it to mice, and it's been protective. And so they'll be moving very rapidly to human trials in the coming weeks to month. And this is a partnership between a virology treatment expert, PhD, the Gates Foundation, and the Defense Department. So over here on one hand we have vaccine stuff going on, but over here we have this antibody treatment going on. And the nice thing about antibody treatments and injections, they're super, super easy to reproduce. They're nowhere near as expensive to develop and then make a massive amount of them, which we can then inoculate people with to give temporary protection to, for classically with a antibody injection for hepatitis A before you go to Africa or something. That's going to give you a year of protection. And so there's a lot of really positive things going on that are going to lower our risk rapidly once we get through this initial next 6 months of kind of trauma. So do your best to stay relaxed. Number 2, zinc, very, very important. I get a lot of messages about questions about zinc. Since it affects your immune system, will it make it worse if you have autoimmune disease? It's the opposite. Natural things, for the most part, balance. And so when you look at zinc supplementation in autoimmune disease, the autoimmune disease goes down, so you don't need to worry about that. People wonder about copper depletion. Copper depletion can happen with chronic zinc supplementation at higher doses. It's fairly rare if you're using, like if you use the one we have at our office, the zinc gluconate capsule, and a lot of the higher end ones from nutraceutical companies that are capsulated, those ones are very unlikely. Some of the tablet ones are a little more likely. And the way to balance that is just to eat some nuts or seafood or hummus, garbanzo beans, because all of those things have copper in them. If you're taking a multivitamin, a lot of multivitamins have copper. So the copper issue is usually very minor. The other thing that people worry about is chronic zinc exposure right now going to cause them damage later? The answer is no. Remember, the reason we're encouraging people to do more zinc is because of COVID-19. 50 milligrams is always fine, but more usually I've always recommended 15 or so, sometimes 50 depending on the situation, especially with hair, but 15 is more of the usual supplementation dose. But in this case, we're doing the bigger dose because we have a specific target. We want your alpha interferon to be high. We want you to have high zinc levels all the time to fight the virus. So it's a specific plan, and I think a lot of people just have a reaction to hearing 50 milligrams of zinc, like that's some significant amount, really. But again, I'm coming from it from a science and a physician point of view. I'm not coming to it from the point of view of someone who doesn't understand it. But so we just have to remember that. The final thing tonight to focus on quickly is just remember, I'm going to post something that is this fantastic statistical modeling, and it really makes it clear why social distancing and containment and sheltering really matter. So it really does matter to stay away from people. It really does matter to stay at home. It really does matter to wear masks. It's not, I don't know why we're calling it a cloth covering of our face. It's a mask, okay? It's a mask. It's nothing else. Masks have two functions. One, and this one almost may be the most important. If you are infected with anything and you cough into your mask, it doesn't go very far. You stop the spread dramatically. So that's a primary use for masks. You're protecting everyone else, even if you don't know it. And then number two, it is going to block your nose and your mouth. So even not an N95 mask, but just a cloth mask is going to do something and be a little more. It's going to definitely be more helpful than nothing if you're going out and about. And then the hand sanitizer stuff, again, just wash your hands. The modeling on the single most important thing to do is to wash your hands and use hand sanitizer all day long. You should be using it if you're not at home the whole time you're gone. If you're at your office, you should be using it every time you touch anything. Just, you think 15, 20 times a day. When I'm at my office, I'm probably using hand sanitizer upwards of 60 to 80 times in the day while I'm there, maybe more. I mean, it's between when I walk into a room, walk out of a room, when I touch something, and I mean, it's constant, and that's what we want everyone to do.
So I already know there's going to be comments, though. Can you address on not being able to find hand sanitizer?
Oh, so Kim's like, what do you do with hand sanitizer deficiency? Well, I think what you do is soap and water. And then number two, I've made this huge batch of hand sanitizer just by going online and going to Google and saying, how do I make hand sanitizer? So I got some 90% rubbing alcohol, which usually you can still find. And then I mixed it with some
Aloe vera.
aloe vera gel and put a little essential oils in it, and that did produce hand sanitizer. Now it's not Perel, okay? It's nowhere near as good. It's very liquidy, but that's how we refilled 3 bottles at our office today, because last week, because we're starting to run out of the Perel, so I have all this other stuff, and I know it's not as good in terms of how it smells or the consistency, but it's totally safe. Oh, and that made me think of one other thing. President Trump did do something very helpful that we should be proud of. He has used that Defense Act to run equipment manufacturing, and he made 3M either yesterday or today, I can't remember which. They have to stop selling their masks that they're producing here to other countries, and they have to use them in the United States, especially since they get tax breaks. That's nice. And he actually also mandated that all the ones they make overseas need to come back here. I don't think that's going to happen with the distributors, but at the very least, if we can start controlling our own produced medical equipment, that will protect all of us. So I want to get off because I've talked for 16 minutes. So you all take care, and I'll do another one probably tomorrow. Good night.